said once diagnosed, what comes next? Like that old 80s cartoon taught us, not knowing is just half the battle. So for that, we have Dr. Soledad Balete to guide us through the principles of lung cancer treatment. Dr. Balete is a former executive officer at UPPGH, Department of Medicine. She is also a consultant at the Metropolitan Medical Center and Chinese General Hospital. She's head of several departments at Jose Reyes Medical Center. She's the head of the section of medical oncology, of the hospital multidisciplinary tumor board, of the credentials committee of the Department of Internal Medicine, as well as the performance governance system and best practice sharing and multi-sectoral governance council. And she's also part of the multi-sector governance council committee. So we are very lucky that she has made time to be with us this afternoon. So let's all welcome Dr. Soledad Balete.
All, so welcome to coming here to have this lung cancer forum in relation to the Lung Cancer Awareness Month. I'm happy to see my friend there, Dr. Rachel. So we'll try, we will keep this simple. So a while ago, Dr. Chavez has told us that the number one cancer killer, and even in the US, the one she showed is Philippines and US. The number one killer is lung cancer. So that is really very striking to know how important it is to be aware for lung cancer about the importance of this illness. Now, a while ago also, Dr. Chavez mentioned the symptoms of lung cancer. So whenever the symptom occur, you have to be vigilant and be on top and know that the symptoms are there. So as she mentioned, the patient has either a smoking history or a second-hand smoke. So a second-hand smoke means someone is smoking and you are there. So it's just equivalent to say that you're also smoking in a way. So then the patient will manifest cough, and then coughing out blood. Sometimes when you cough, there is blood. And you will also, at times, you will feel that your voice, if you're a singer, now you are no longer a good singer because your voice becomes hoarse. And then wheezing, like you're having some form of hiccup this time. Then you suddenly feel na your weight is already decreased, your weight becomes thinner. Before mataba, now you're already payat. For no reason at all, meaning you're eating well, pero you're losing your weight. Difficulty in swallowing, sometimes you feel something is there to block your food, and then you need to have yourself be seen by a doctor. Basically, when you see a doctor, they will do X-ray. Chest X-ray is what they do at first to see. Then the doctor will advise you if you need a CT scan. Kung sometimes they don't see a mass, but they are thinking something is there, they will request a CT scan. So early detection for lung cancer is important because it will save your life. As mentioned a while ago by our speaker, mostly the lung cancer, when the symptom appear, then the stage is already advanced. So around 20% will come as early. 20 means kung may 10 patient, 2 will be early, 8 of them will be, tama ba? Yeah, 8 of them, 20%, in 10. So 8 of them will become advanced, meaning it's really high. So the best thing is really to avoid those risk factors. Kasi once the lung cancer is there, the symptom will appear, the stage is already advanced when it is discovered. So here it is also like the CT scan showed. This is a CT scan view. The white on the right side, on your side, on right side is a mass that you're seeing. Also there on the left side, on my side, and left side on my side. On your side, left from your side. So in this situation, usually a needle is inserted like a hiringilya so that the lesion will be pierced through, dadaan, so that a biopsy can be taken. That is what we call a CT guided. There's a CT scan that will guide to make sure that they will hit the right one, not the other one that is black, but the white with a circle. So as we can see, this is showing to us that the lung cancer treatment over the years, not pababa, it's going up, meaning improving as time goes and as years come, more options are being given to us. So that the surviving years, when I was in training, mga less than 5 lang. So that was mga 25 years ago when I was a student in cancer medicine. But now, it's already 22.9 and still rising over the years. No? So very good kasi we have more options. So 22.9 is around, shall we say, 25%. So that's good from the time that it was less than 5. So you can also see before, yung early part, yung mga years back, 1890, the only option was radiotherapy. When a patient is diagnosed with lung cancer, sasabihin wala na, radiotherapy ka lang. So, and then as time goes, the radiotherapy naman the patient is being offered surgery, meaning option of surgery. But the problem of surgery, as I have said, it can only be really applicable to the early stage. And as I said a while ago, many of the lung cancer are of the advanced stage when they present with symptoms. Then aside from the surgery, we have the traditional chemotherapy. Kasi sometimes when patients come, they will say, when I see a doctor, an oncologist, they can say nothing except chemotherapy. But nowadays, it's not like that anymore. We have more options, no? As the projection is going up, more options are coming. So 1998 to present, we have the precision therapy, what we call the targeted, which we will describe shortly after this. Then also, as years come, 1997 to now, immunotherapy naman. So we will go into it one by one. So surgery, as you know, is being done by a thoracocardiovascular surgeon, not us, no? So the surgeon do the surgery in order to tatanggalin the mass. The goal is to remove the cancer from the body and along with some normal looking tissue. So removing the mass and the surrounding normal tissue, the normal tissue is called the surgical margin. So this is applicable sa early stage lung cancer, wherein surgery can be done so that the mass is removed. Once removed, then the mass is no longer there in that spot, the yellow one there. Then aside from the surgery that was mentioned is radiotherapy. So both surgery and radiotherapy are what we call local. They are both local therapy. Ibig sabihin ng local, you can imagine you get a flashlight and focus that on your, let's say, on your face or your body. That's local. May local application, no? Imagination of a flashlight, putting it wherever you want, so that's local. Then this is administered by a radiation oncologist, not a medical oncologist. This uses high energy X-ray to treat lung cancer. So, and it damages cancer cell, and the cancer cell either die or stop from making new cancer cell. So, the radiation is very strong enough to kill the cell even down to the DNA, yung mga gene niya. It can also kill down to the DNA. It is offered delivered by a large machine as shown here, and the X-ray, the radiation go through the skin, so dadaan sa skin and travel, go to the tumor. No, have you seen a laser? When you have seen a laser, if you're playing with a laser, you can imagine how precise and how deep the penetration, no? Something like that. And then the healthy tissue is protected using some shield in order to just hit the cancer cell. Now, chemotherapy, I know you have somehow you have relatives na nagkaroon na ng mga treatment. So it's just like putting a suero over the vein, or sometimes the suero is put here using the portacat. So chemotherapy is termed to cover the drugs that kill the rapidly dividing cells. Meaning when the cells are active, so the chemotherapy is very good in killing the cancer cells. So the patient will need to go to a treatment facility to be able to receive chemotherapy. So ano yung treatment facility? Normally in mga hospital, we have treatment facilities for cancer treatment. And the chemotherapy like that, the patient is seated and with a suero, the chemotherapy is injected into your vein, and this is called infusion. Then the drug will travel to the blood, to the entire body. It will go to your blood, the whole body. So meaning, the one I mentioned a while ago, surgery and radiotherapy is just like putting a flashlight, diba, local. But here, the drug will travel. So that's why it can cover what we call the micrometastasis, the things that you cannot see, yung somewhere there that you do not know. So chemotherapy will cover that. Now next to this is we have so the precision or targeted therapy. So yung targeted therapy belongs to the newer innovation na. So this works by influencing the process that control the growth, division of cancer cell, as well as the signal that cause the cancer cell to die naturally. They selectively target cancer cell with specific mutation. They are more effective and has less side effect than chemotherapy. So the targeted therapy is like parang a husband looking for a wife, di ba? So the husband would choose the best target, meaning he doesn't choose any woman. So sabi niya, this will be my wife. So he will target the person, or this one, the medicine will target the cancer cell using the target that the medicine will act upon. So very specific yung target niya. So what is the target? Kasi when you target the part, there is so-called the downstream, meaning may trigger. So when you target, parang if you want to target the head, para there will be no more influence down to it, para tumigil siya, then you have to target that part that will cause the so-called signal, downstream signal, meaning pag huhuli ka ng masamang tao, what you will do, you have to make huli the bad person, the leader. And then the other members they will be, magkakagulo because the leader is already blocked. Diba? So parang yan parang mga bad dun sa mga war, diba? If you want to stop the war, you have to catch the target, the person who leads the war. So parang ganon, no? You have to be precise in knowing who is the bad person here, who is the bad cell, who is the leader of the bad cell. So you want to target the leader. And then you will make sure once you target the leader, the other apo-apo and the other down, the bad people down, bad cells down there will obey because the leader is already trapped. Something like that, no? So usually the targeted, nowadays, we have the oral. That's why the picture there is a tablet. We have the oral. So the patients, when you see that the patient, usually you check the specimen. Can this patient be applied with this target? Is there something that I can target? If there is none, there's no use that I would target. But if there is something that I can target, pwede ko i-target, I will give this medicine that will target this one that I will target. And then, once you target the targetable, what we mean yung pwede ko i-target, makikilot siya. And then, the cells will stop multiplying. Kasi you already catch the bad one who is the leader, no? Who tell the other members na you stop already because I'm already shocked. No? So there is a specific target. And because of this advent, nowadays, the patients, they would prefer really the oral. Kasi nga, convenience, ganyan. Pero just a caution, not all patients with lung cancer, they can be given target. Before you give the targeted drug, there is some tests that we need to do in order to see kung the patient can receive the target. Meaning, is there something that we can target? If none, if we do not know where is the leader, or what is the name of the target, then there's no use that we will target. So we have to know that by testing the specimen or the target. No? Now for the next treatment, that is what we call the immunotherapy. This is the difference of chemotherapy versus targeted. So yung chemotherapy sinasabi ko are those before when the patient has lung cancer, what we offer chemo o chemo, gano'n. But now we have targeted na. Now for chemotherapy, it acts by damaging rapidly dividing cells, yung mga active cells. That's why they have more side effects. What are the side effects that you know? Loss of hair, no? Or sometimes the patient feel weak, the blood cell, the red cell, the white cell goes down, infection, admission, ganyan, no? But with the advent of targeted treatment, this is unique to cancer cell. So this medicine will cause the disruption of the pathway. Kumbaga yung downstream signaling, yung downstream utos niya pababa na pag trap na siya, no more utos na sa pababa na you have to multiply. Then this is unique to cancer cell which is absent in normal cell. Yung being bad influence niya is only seen in the cancer cell. But in the normal cell, mabait eh. So mabait siya, walang ganon. Then generally, they have milder side effect. The tablet that we're mentioning has mild side effect. Usually, mga rashes or some form of diarrhea. But relatively speaking, this is also a little bit a cost. Cost is also a concern. But although we have certain program now wherein programs are offered in order to help the patient. Now, next is the immunotherapy. I think the immunotherapy part becomes very clear to you during the COVID time. When you heard about ano yung immunotherapy sa COVID, tocilizumab. No, I'm not plugging, but it's just to make things clearer. So the immunotherapy works by, remember that the body's defense against disease is called the immune system. Yung panlaban natin sa ating mga condition or sakit, anong tawag? Immune system natin, panlaban. Soldiers of the body. So the soldiers of the body are T cells. The T cells are the soldier, which are the key part of the system. So the soldiers, the T cells that kill infected and cancer cell, that the soldier will kill the cancer cell, they are called the killer T cells. Then immunotherapy is a treatment that uses the immune system to kill the cancer cell. The immune checkpoint inhibitor are a type of immunotherapy. They work by releasing the brake pedals on the T cells. So what cancer do is that they will utos the soldier of our body, which are called the T cell. So the T cell, who are the soldiers of our body, are already, they are already not functioning as a soldier. No? So when we have the immunotherapy, they will help the cancer cell that stop the T cell, saying na T cell don't work. So with the immunotherapy, they will help the T cell. they will help the T cell, they will help the immune system so that the T cell, the soldier of our body, can go back to normal. So that they can function. Kasi ang function ng T cell is the soldier cell that provides our immune system. So napipilayan sila kasi masama si cancer cell. So since they are no longer working well, then the immunotherapy there is to help the immune system. Kasi may mga inhibitor yung cancer cell doon. So for the body not to function well sa immune system. So we have the immune checkpoint inhibitor are a type of immunotherapy that will release the brake pedals on the T cell. Tatanggalin nila yung mga naghihinder sa T cell na mag-function normally. So sila yung tutulong para si T cell, yung soldier cell will function to its function to serve as the soldier of our body. So do you understand? So that's through the, it's through the suero. It's through the, just like parang chemotherapy, it's given through the IV. So, as we move along, we are saying that in managing cancer, lung cancer, we employ what we call multidisciplinary. Sometimes when my patient asks me, why is it that I have many doctors seeing me? So I said, if you're a patient and you have many doctors seeing you, you're in the right track. Because this is what we call multidisciplinary. Ibig sabihin, nagtutulong yung mga, nandun yung lung doctor, there's the radiation, who does the radiotherapy, radiation oncologist, the surgeon, the chemotherapy, medical oncologist, they talk and then they discuss how and what we will do to our patient. You're not being just managed by one doctor kasi they talk, they discuss for the benefit of the patient. So that you can employ kung you want radiotherapy ba, surgery, chemotherapy, immunotherapy. So that's why discussion is being undertaken. That is what we call a multidisciplinary team effort. So in summary, the recent trend, yung mga bagong mga offers ngayon na treatment, shows improvement. These are the reason for the improvement in the survival of lung cancer due to the advancement. No, not just chemotherapy, not just surgery. And we have now 5 that we discussed treatment option in our lung cancer patient. And we have, as mentioned a while ago, surgery. We have mentioned radiotherapy. It's a local treatment, just like surgery. Chemotherapy, it is putting a suero and then the medicine will go to the blood so that it can act to the whole body. It can go to the whole body of the patient. The targeted, it will be targeting the patient's, sabi ko nga, the blood leader. And then, but there is a need to test the specimen if there is something that you can target before we give the target. And immunotherapy, as I said, is just like the one used by the COVID time, wherein we give immunotherapy like tocilizumab, so that we can help our immune system to function normally. Otherwise, our immune system are impaired. Hindi na sila gumagana the usual way. So you need to give immunotherapy to help your T cell so that the T cell will not be, sabi nga, may break siya, may break pedal yung T cell because of the cancer. So so that rather there should be a brake pedal to stop the cancer cell from stopping the T cell to take its action to become a soldier of the body. So hindi na siya soldier kasi cancer cell will make him useless. Pero kailangan with the immunotherapy, it will serve as the brake pedal of the T cell. So the treating lung cancer involves team of doctor specialists, yung na-mention natin, multidisciplinary team effort to provide best option for the lung cancer patient. So that's why if you have a patient, a relative who see not just one doctor, you should not be saying or thinking na the doctor maybe doesn't know, but actually it's the right way to manage the patient by the multidisciplinary team. So I prepared a quick question lang, kasi quick lang. Yan. So para raise hand lang. If you never smoke, you don't need to worry about lung cancer. True, false?
False.
Ha?
False.
Oo, kasi based on our first discussion, even non-smoker, di ba, they can also get lung cancer. Yung mga non-smoker. And even yung mga passive smoker, yung mga nakaupo ka, pero yung husband mo, grabe, no? Grabe mag-smoke. So, pwede rin. 6 question lang po. There is nothing people can do to lower their chance of getting lung cancer. Pag sinabi bang, ay, smoker naman ako, so sige, smoke na lang. So, meaning, nothing we can do ba to lower their chance?
False.
True, false?
False. False.
Medyo negative yung question, no? There is nothing daw we can do to lower their chance of getting lung cancer. False? True?
False.
False. Ang galing nyo. False. Kasi we can do something. Foremost, if you're a smoker, you have to quit smoking. Diba? So, or anything that cause you to have increase your risk of lung cancer. For people who smoke, much of the lung damage can lead to cancer can be repaired if they quit smoking. If they quit smoking, can the repair be true, false? True, false. Pag nag-smoke ka, may mga damage na yan, so wala na. So, I can smoke, or I would decide to stop. Siyempre, hopeful thinking or positive thinking. When the patient stops, foremost, in 2 to 3 months, you would see improvement in the circulation of the blood. Kasi the smoking itself can cause our blood to thicken. No? So the circulation will improve. In 10 years that the patient would stop smoking, let's say 10 years, the risk would be decreased by 50%. And if there are symptoms like parang naghihingal-hingal siya, there is around 10 months, the patient's symptoms will improve. So there is hope. No? When the patient decides to quit the trigger or the risk factor, there is hope that the lung somehow, the repair, there is hope that this symptom will improve. So there is repair in the lung. No? So, therefore, those who are smoking, you have still hope not to continue smoking. So, replacing cigarette with the spit tobacco or snuff is safe way. Kumbaga, okay na ako. Replace the, what you call that? I don't know the name. Oh, yung vaping. I know it's letter R. Something else, so it's letter R. So, is it, replace? Okay na, replace? Yes, no? Sino yung mga pro-vaping, anti-vaping? So, actually, it does not assure us that it is a safe way. In fact, if you do that, there's also increase in the chance of what we call the upper airway malignancy. Yung tinatawag na either dito na sa throat or sa lung, or not lung, or somewhere here na the head and neck, what we call the head and neck malignancy. The throat, the mouth, the pharynx, ganon. So there is an increase in the malignancy in that part. Kasi nga, where does the snapping goes? It is where it goes, no? Lung cancer is one of the deadliest cancer. Of course, first speaker. True, false? True. Siyempre true. Kung hindi, no lung cancer awareness month. Lung cancer often does not cause problem until it is too late. True, false. Meaning, my symptom it's usually not the early stage. True, false. Huh? True. True. Okay. So, I hope you understand or get some points from our discussion. Thank you.